Good afternoon, ladies and gentlemen. Welcome to the Health and Wellbeing Board of the 5th of July 2023 on quite a nice afternoon. We've got a packed agenda for the afternoon, and we'll be trying to run to time as much as we can. And I'd like to start by taking any Adrian apologies for absences.
Thank you, Chair. I have apologies from Councillor Scott Carlton, who is substituted today by Councillor Tom Smith. I have apologies from Jonathan Gribbin, who is substituted for by Viv Robbins. I have apologies from Sharon Cadell from the Office of the Police and Crime Commissioner, from Melanie Williams from the County Council, and Dr. Dave Briggs, who is being subbed for today by Dr. Stephen Short.
Thanks very much, Adrian. The last hour between 1 and 2, we're doing an introduction to the Health and Wellbeing Board, and I'd like to welcome the new district representatives who are here. And we have our first job share, Caroline Ellis and Angie Jackson from Mansfield. Look, even sat together, inseparable. Yes. We've also got Lynn Schuler from Bassetlaw. Where are you, Lynn? There you are over there, Lynn. Sue Crosby from Newark is over there, and Jonathan Wheeler representing Rushcliffe. So quite a change, and when you put that together with the changes that are occurring locally as well, it's a really exciting time to be part of health and wellbeing in Nottinghamshire. Declarations of interest. Does anybody here present have any declarations, pecuniary or non-pecuniary, that they'd like to disclose at this point in time? If you don't, if you think of something throughout the meeting, just put your hand up and let us know. Excellent. Minutes of the meeting of the 24th of May. I can say that I wasn't present for the minutes of the meeting. You were present for the minutes of the meeting, Tim. Yes.
Yes, I was.
Would you like to go through those pages and make sure that everybody agrees with them? Page 1.
Yeah, I've been through those, and as far as I can confirm, they are inaccurate. No evidence or sufficient, so a true representation of the minutes.
Thank you, Tim. So just for recognition of a true record as opposed to open for debate or conversation. We're quite happy. All those in favour? Thank you. We'll pass those as accurate. Now, the Chair's report, item number 4, just generalities with regards to the world in which we live. It's 75th anniversary of the NHS today. Back in 1948, Nye Bevan set it up and for the first time in history separated health from social care. And the big thing we're trying to do these days is to create one system of health and social care. But back in those days, we were dealing with the post-war situation. We were dealing with people coming back from overseas. We were dealing with malaria, diphtheria. We were dealing with outbreaks of everything from chimney sweepers, lungs. Tuberculosis was the big one, but infectious diseases were the driver of the needs of the NHS, whereas nowadays it's actually longevity and obesity. But the impact of that on illness and cancer and disease is the most dramatic change since it was started in 1948. Back then, a woman used to live for 65 years and a man on average to 68 years of age, or the other way around actually, a man to 65 and a woman to 68, and nowadays it's about 80 and 82, so there's a significant increase in people's longevity. In terms of the report itself, this is a report put together by Brian E. Jones, Bryony Jones sometimes can get up to 100 different items that she wants me to comment on that have happened nationally, locally, internationally, globally, etc. But we narrow it down in case anybody's got anything that jumps out at them. I was sort of drawn to item number 18. And item number 18 is the recommissioning of the sexual health services in Nottingham, where we're going largely online and we're making it more accessible. We're driving people to utilise the services, which are incredibly popular. However, the converse to that is that in 1948, two of the biggest diseases that existed were gonorrhea and syphilis. And now in 2023, the latest statistics say that the number of cases of gonorrhea at the highest in records began since 1918, and syphilis has also significantly increased. So the number of these diseases is now far higher than it was when the NHS was even created, and that's why it's so important to recommission available sexual health services that people will utilise. Now, to some degree, there has been an increase in the amount of testing, 13% increase in testing, but it nowhere near accounts for the huge growth in the actual amount of disease that's out there. So sexual health services, if we neglect it, we're already at post-war levels, then it is just sort of a time bomb in the making. I'm going to bring you forward to item 29, which is tobacco. You're all aware that we're looking at a smoke-free Nottinghamshire. We'd like to get smoke-free by 2030, 2035 or whatever. I suppose you could juxtaposition that with the New Zealanders trying to go for 2025. So there's huge ambition out there. And the great challenge that exists is that we want to promote something which is incredibly safe, i.e. vaping, which we know is 95% safer than smoking, and yet at the same time we want it to be utilised by the population that we need to stop smoking, which is the population of adults, and population of adult smokers, and those we want to reduce. And yet at the same time that's come with the challenge of a group of people who are never the intended individuals, which are children, and the increase in vaping amongst young people. So that's the challenge as we move forward, stopping children from vaping and at the same time encouraging those people who do smoke to take up vaping to help them as a form of withdrawal as opposed to a long-term use. The Royal Society of Paediatricians has recently called for a complete ban on single-use vaping, and they're worried about the long-term consequences of it. And Australia have gone so far as to make them prescription-only medications. So I think we're going to have some challenges down the line with regards to vaping, although it remains a core part of the public health strategy to make Nottingham smoking-free by 2030, but the challenge being to stop them being used by children, basically. So that's that. I'm going to mention 35, item 35, which is oral health, suggesting that overall nearly 25% of under fives have experienced dental decay. And in the paper that's coming after this on the COVID impact of pregnancy and early years, there's a significant decline in the amount of children who've been able to attend dentists, and get dental care, and we'll do that in a little bit more detail later on. Tillum, anything to add from that you've noted?
Uh, yes, Chair. For me, I just wanted to uh, start with point 34 and link that with point 44. And it's the one on healthy food vouchers, saying the government had missed its target of increased take-up of NHS healthy food vouchers aimed at vulnerable parents of young children. Particularly, we know Mansfield and Ashfield districts where nearly 31 neighborhoods are less than the 10% of the most deprived areas. So is this what where my understanding and part of my ignorance is that how can we increase the uptake? Is this something which there's local variation? Is this I'm thinking about the local neighborhood teams, the frontline workers. Is there a way of how we could try maximizing using the every contact count principle, identifying the relevant families and see how we could increase this uptake, because otherwise it has a direct impact on the sure star, the one about malnutrition, which is number 44. So I think there's a missed opportunity here if you don't maximise the take-up of NHS healthy food vouchers.
Where's Viv? Where are you? Viv, would you like to comment on the activities that are driving the uptake of food vouchers, and in particular the activities that are perhaps not taking place that might make them more utilised?
No problem. So I might ask some colleagues behind me as well to help in on that, because this is mentioned. I'm pretty sure I've seen this in COVID impact assessment, haven't I? So it's whether you want to cover it now, Chair, or whether you want to cover it as part of the COVID impact assessment, because there is quite a lot of detail in there. But absolutely acknowledge this is an area we can continue to progress and really think around how we do support the communities that we know are struggling, particularly in the financial climate that we've got. So it's whether you want to do it now or whether you want to do it separately.
Yeah, we'll do it later on.
Yeah, okay. So can I just ask colleagues at the back then, can you just make sure that we do cover that in a little bit more detail next week? That's all right, thank you.
Councillor Wilmot.
Thank you very much, Chair, for allowing me to come in. Obviously, I've got a number of observations in this report. The first is congratulations to the NHS on the 75 years. It is still the best service in the world. I'm absolutely assured of that still. However, it's got lots and lots of problems. We all realise that. But don't forget, we are very, very lucky in this country to have such a service anyway. And the amount of problems, yes, there are problems, but it's the people that bring them forward are a minute amount than what's the people that are happy with the service. It is a remarkable service, yes, as I say, and I hope everybody continues to help as much as they possibly can. If they see any problems, and report it, and let's see if we can get it sorted, because the pandemic did a lot of damage over a number of years, as you know, and we're only just starting to catch up on much of that situation, and hopefully it will get better. I welcome Mansfield District Council's achievement, actually, yes, in obtaining the Domestic Abuse Housing Alliance accreditation. We've all got to admit, domestic abuse is a scourge on society. It really is. It's caused by numerous problems, including family fallouts, lack of financial stability, mental health, illness, stress, betting and drug addiction, which I've been on about for so many years now, but nothing seems to be ever done about it to try and help these people. And which we see on the television every day, thousands of these adverts. Get rid of your money. As far as I can see, it's easy for us to talk about it, but we've got to start and do something about it, and helping people, because a lot of people, it's an addiction, and when what's worse for an addicted person is to continually get advertisements to carry on spending your money and doing this. It's a terrible situation. As I say, as far as domestic abuse, we must do it helping these people and stop the harassment that they're causing. But we've also got to think about the perpetrator. Yeah, some of them are nasty people, but we can't just leave it at that. We have to have a look at the situation. How can we help this person in stop him doing these terrible situations? And I just wonder if enough is being done in that area. A big thank you must go out to all the community groups. I mean, we all know what community groups do. Some of them are fantastic, and their work, they give up their time to distribute all the food and so forth. I'm glad to tell you that there's a new extra food bank opening in Hull shortly, which I'm so pleased about. It's unbelievable. And for those that feel that they're not needed, believe you me, they are needed. If we go out into the community, I know in doctors' surgeries, you must get people crying in there because of the state of their family.
Yeah, we give out the food vouchers.
Yeah. So it's essential that we do as much as we possibly can in that way. In your report on the opening hours of the pharmacy in Uthwaite, yes, I've got two little anomalies there that I think you need to have a look at some time. I feel that in your report, there are two anomalies that need addressing. They are Saturday closing, which means any person working Monday to Friday, the same hours that the pharmacy is open, would find it difficult to pick up prescriptions. And if the pharmacy is not open, and on a Saturday morning, to say other pharmacies are open only 10 minutes away, if you haven't got a car and you've got a disability, that's a heck of a time. The problem getting there is abnormal. It really is. And as far as the health and wellbeing survey in schools is concerned, I fully support all the actions. Yes. However, there may be a shock coming to some people when they visit. It seems that vaping is is happening in schools, and that pupils are well aware of the drug taking in society. And I just hope that they manage to keep out of it, because it's being published everywhere, and I don't know. I don't know the answer to it. Homeless family problems, according to the report, is very serious. Poor quality housing costing the NHS 1.4 billion a year on treating family illnesses, due to the fact that they're living in cold conditions. That has to be looked at. If that is, I mean, that's what it said in the report, and I've seen it in other reports. If that is correct, then it's got to be looked into. There's no doubt about that. As I say, it says in the report that it is estimated that £1,000 only would put the problem right in each home. Well, that's not a tremendous amount of money when you're looking at the billions that's been spent on other issues. So surely some money should be make sure that the houses are nice and safe, because it's going to save the NHS loads of pots of money in the end, because people aren't going to get ill. We've been having cold homes.
Thank you very much, Councillor Wilmot, for that contribution. We'll come back to some of those answers, no doubt, throughout the afternoon. The pharmaceutical needs assessment assesses the number and the provision of services and hours throughout the entirety of Nottinghamshire to make sure that it's adequate, and was deemed adequate in the case of the Hutwaite pharmacy that you mentioned before that. I'm going to just go to Councillor Henry Wheeler, then Councillor Tideswell, and then we'll move on to the substantial COVID impact assessment. Councillor Wheeler.
Thank you, Chair. I'd just like to comment on the National Tobacco Strategy. I welcome the government's announcement. However, I don't think it goes far enough. And I also feel, obviously my views on vaping are well known in this chamber. I hate the things. Young people, basically, they are dying from vaping. And I know young people personally that are vaping that have been now starting to have problems with oral health, yes, but also breathing difficulties as well. And I think we do need to start taking a tough stance against vaping, particularly when it comes to young people. I totally get it. I totally get that they can be used as a tool to help adults pack up smoking, but I actually believe that they should only be used as a smoking cessation tool via prescription at pharmacies only. Yeah. Okay. I think there are a variety of things we can do to help children pack up the vaping habit. One of those is to put the things out of reach young people. Increase fines for retailers selling illicit vaping. Basically ban the stuff that's been deliberately aimed at children completely. We've significantly increased fines for those being sold to people selling them to under 18s. I think the Department for Health needs to sort of respond urgently with the £3 million promise for illicit vaping enforcement squads for them to be formed. I think that needs to happen quite quickly. And I think obviously at the local level there needs to be an increase in the power and capacity of local trading standards teams to enforce new regulations and licensing. And I think actually also moving forward, I know Ash recently commented on vaping and the way it's causing issues for young people, and I would actually go as far as possibly looking at the taxation system in terms of regulations, so a £5 tax, for example, being imposed on vapes to make them less affordable. Thank you.
Yes, thank you, Councillor Wheeler. Yes, the concerns are recognised, as I said, with the Australians putting it as prescription-only medications, etc., and the Royal College calling for a ban on Vivian.
Yeah, thank you, Chair. I just wanted to provide a little bit of local reassurance because obviously a lot of the measures that you talked about, Councillor, really are more national issues. But I just wanted to provide a bit of assurance around the work that we're doing locally in Nottinghamshire, because we absolutely acknowledge that tobacco and vaping as part of that is a really important priority for Nottinghamshire. And as much as we absolutely see the benefits of vaping as a aid to stop smoking, we absolutely don't want to be, encouraging people to take up vaping, particularly as the evidence base is evolving and things like that around that. So I did get a bit of an update in terms of from Kath Pritchard, who is the consultant lead on tobacco, to make sure that we've got some of that for you. And there's a lot of work going on across Nottingham and Nottinghamshire between the Tobacco Alliance, and there's a couple of areas I just wanted to sort of highlight. So there is a phased approach around e-cigarettes and using vaping. So that particular at the moment is concentrating on those with substance misuse and those accessing the lung health check. So really thinking around how we're prioritising the approach so we can test and learn that approach before the sort of wider uptake. There's a lot of work going on with trading standards to really understand how the sort of illicit market around vapes, but also tobacco and alcohol, is working locally, and also what work we can do. And they're doing some fantastic work around, seizing some of those goods across Nottinghamshire. There's quite a lot of work going on in schools as well, which I think is really, really positive. So we've got the intense smoking programme in secondary schools. At the moment, there's only 12 schools that have signed up to that programme. Now, we're really keen to get all our secondary schools across Nottinghamshire signed up to that. So if there's anything anyone can do to advocate and support that, we would be really grateful. And Kath would be absolutely keen to work with any schools around that. And some of that also brings into, there's some work going on around a whole school vaping approach. So we really understand that there's a direct impact, not just on the health and well-being of the individuals vaping, but also some of the impact that can have in terms of the impact that's having on lessons, attendance and things like that. So it's really thinking of that in that more global sense. The final thing that I just wanted to highlight is we've got a behavioural insights and health related behaviour survey that's coming out. Well, it has already started. And that's looking at year 6 and year 10 pupils, and it's really trying to understand their views around health and well-being, but specifically looking areas around smoking and vaping, so we can really understand where people are at in Nottinghamshire around vaping. And then the aim is to then develop a social marketing campaign around that. So I think there's some really positive areas going on. I think it's just to try and provide that little bit of reassurance that we've had discussions at the board already around tobacco. It is absolutely a priority in the joint health and wellbeing strategy, and we continue to work hard at it. If there's any other information that people would like on that, yes, I'm more than happy to take that and then link you in with Kath later on, because also there's roles around PBPs and how they're thinking that. But I know a lot of PBPs have got tobaccos on their priorities as well. So thank you, Jim.
Thank you. I'm just going to go to Councillor Tideswell.
Thank you, Chair. Evidently, Councillor Wilmot's perception of the health service is totally different from. We must be looking at the health service through different tinted glasses than I've got on, and also my hearing aid must be picking up totally differing conversations than Councillor Wilmot. I'm not going to carry on because it's already being explained by a lot of people on television, etc., etc. And the other thing, item 34, best start, as Councillor Doddy gets fed up with me going on about early learning centres. They have done the health service and the areas that I is counsellor for. These vouchers, food and vitamins and everything, I cannot carry on expressing how vital they are for our areas. And also item 35, oral health survey. I know that the Early Learning Centre have been very, very proactive. In fact, Broxtowe, 2 years ago, had one of the most proactive results for oral health. In fact, it was that proactive, Health and Wellbeing decided to take it off and privatise it. That's been the story with early learning centre for time and time. But if you go the items after page 31, there is hope that maybe one day soon that proactivity will return back to early learning centre instead of taking the health service off it and everything else that's been taken off it. But there is another positivity I can actually pass on to the Health and Wellbeing Board. It was highlighted to them that in Eastwood breastfeeding was very low, and they decided to send out outreach work to Eastwood. To the point now, whether I should mention this before they take this off them, it has actually, breastfeeding has actually increased by 28% in Eastwood. So I'm hoping that Health and Wellbeing doesn't take that job off them. So yeah, they are my comments regarding this. Yes, sorry, Dorothy, I'm carrying on about Early Learning Centre.
No, that's absolutely fine. And some of the things you mentioned may indeed be perfectly relevant to item number 5, which we're going to move on to now on item number 5, and that is the Nottinghamshire COVID impact assessment on pregnancy, childbirth, and early years. Has there been a woman who's pregnant who wasn't negatively affected physically to the mental health? Families who couldn't attend deliveries, children who grew up without seeing relatives and close families for years, etc., not going to the dentist, dental care's impact on the wider community. Over 100 pages of detail. Lucy and Helen, fantastically detailed, and I'm going to pass it over to you to present it to us today.
Thank you very much, Chair. Hi, I'm Lucy Hawkin, Public Health and Commissioning Manager working on the Best Start agenda here with...
And hi, I'm Helena Cripps, also a Public Health and Commissioning Manager.
So today, as Councillor Duddy highlighted, we'll be sharing with you some of the key findings and recommendations from phase 6 of the COVID impact assessment, which focused on pregnancy, childbirth and the early years. So the impact assessment is split into these 3 sections, which we'll run through in turn, and focuses on pregnancy up until age 5. So as part of the work, we undertook a literature review and we analysed local, regional and national data. We also did some local engagement, and that involved conducting both focus group with some early years professionals, and then we ran 2 surveys, so one for parents and carers and one aimed at professionals. From those we got over 200 responses, which gave us some really useful local insight into the impact of COVID during this period. The impact assessment is owned by the Best Start Partnership, which is a subgroup of the Health and Wellbeing Board, and the 18 recommendations fall under these 3 areas, with some additional recommendations around publishing our Best Start for Life offer, inequalities and blended service delivery. There's also an action plan, which you can find in the appendices. So the first area we focused on was parents and carers' wellbeing, and overall the local picture from our survey closely reflects what was found nationally and within the local Maternity Voices and Health Watch report. And that was really with COVID having a largely adverse impact on those early experiences as parents and their overall wellbeing, as you can see illustrated on this slide with the various quotes. Despite acknowledging staff in many circumstances did all they could, many parents expressed being negatively impacted by various experiences throughout pregnancy, birth and those early days, which for some then impacted on bonding and their ongoing mental health. Many reported feeling lonely and isolated. Because of the national restrictions, it meant they had to attend appointments on their own, and that was especially upsetting for those who received difficult news in those appointments. Obviously then also not being able to attend baby groups and spend time socialising and being supported by family and friends was challenging for many. However, it is important to acknowledge this wasn't necessarily the case for all, as for some, it did mean they could actually do more with without the pressure of visitors, which actually acted to enhance bonding. And then some fathers also got to spend more time with their babies and children, which they wouldn't have previously had. So from these findings, there were a handful of recommendations focusing on strengthening support, our perinatal mental health pathways, and enhancing our antenatal and preparation for parenthood programmes.
Thank you. So next we looked at children's early development. So here, professionals told us that there'd been a huge impact on children's early development, particularly on their social and emotional, their communication and language, and their behaviour. And that's also what the literature and the evidence quite clearly told us. Interestingly, the parents we surveyed and the parents who responded to our questionnaire weren't so sure of an impact on their child's development, but the parents that did choose to leave and share comments to that survey shared some really powerful feedback that we've included throughout the main document because we think it's so important to reflect. In 2022, we found a decline in the proportion of children meeting the expected level of development through their health visitor review at age 2 to 2.5. And that was particularly in relation to children's communication skills and in relation to their social and emotional skills. And that was babies who were born in or just before initial lockdowns, who were then becoming 2 to 2.5 in 2022. We're very pleased to say that that's recovering. So that's recovering later in 2022 and is carrying on recovering into 2023. We also found an increase in demand for specialist speech and language therapy services, and lots more children presenting to that service at age 3 to 4 instead of at age 2 to 3, and it is preferable for children to access as early as possible, so age 2 to 3. The recommendations here focus on addressing that increase in speech, language and communication needs that emerged particularly in the group who were most affected by the restrictions of the pandemic. So that's children who are now aged 2.5 and above. And there are also recommendations in relation to healthy social and emotional development and some other recommendations in this section as well. And hopefully you can see from the action plan that we've appended to the main report that those actions are progressing well. So I'll move on to early years health outcomes. So here we looked at lots of different data points. There are a few key things probably to pull out today. So breastfeeding prevalence remained relatively constant, whereas actually in recent years we've seen slight increases year on year. We've got a really long-standing, quite entrenched variation in breastfeeding rates across Nottinghamshire. And when we look, it does look like there was an adverse impact on breastfeeding rates in Bassetlaw and in Mansfield from the year before the pandemic to the first year of the pandemic. Parents, in terms of their feedback and responses to our survey, shared some really mixed experience of breastfeeding. Some had fabulous experiences, others felt that they struggled to access services and supports. A&E attendances in under fives dropped throughout 2020 and the troughs very much mirrored the national lockdowns. That has since recovered and actually increased a little as well. And then there was a sharp decline in the number of under fives accessing a dentist in the first year of the pandemic, and there wasn't a full recovery in the next year, 21-22, so a kind of a moderate recovery the next year. But I do need to say that those aren't challenges that are unique to us locally in Nottinghamshire. There are national challenges in access to dentistry. And then finally, vaccination rates across the childhood immunisation programme remained relatively static across the pandemic, so there wasn't anything particularly significant to pull out there. So the recommendations for this section include targeting our breastfeeding support, includes targeting our vaccination uptake and understanding some of those trends in very individual areas geographically and also particular kind of demographic groups, and understanding patterns in A&E attendance. So, in summary, it is very fair to say that the pandemic had an adverse impact on pregnancy and on early years. But I do need to say that this report isn't all-encompassing. It's a review at a point in time based on the best information that was available to us, and I must stress that actually there wasn't a universal experience of the pandemic, so experiences differed hugely depending on the individual circumstances of different families at that time, and for some it was a really positive time as well, so we must remember that. I'd just like to highlight that the recommendations have got the support and the oversight of the Best Start Partnership, and the implementation of these recommendations are very much being considered hand in hand with the implementation of our Best Start strategy, which you'll also hear a little bit more about today. And hopefully with evidence that work to implement the recommendations is well underway for many, if not most areas. So I think then we ask the board to recognise the findings and the actions that we've put in place and consider whether there are any further actions that the board thinks are required or where they might be able to offer some support. Thank you.
Yes, that will be correct with the recommendations. It is a very comprehensive report, and one would think that some things, like breastfeeding, when you're in your own home, where you're limited in number of visitors, where you perhaps are furloughed and don't have the pressure of work, where you are there with your newborn child, some of those almost seem like the perfect factors for bonding and successful breastfeeding and things, and yet surprised that it stayed neutral or was negative in one sense when the environment that you were creating. But it almost suggests how crucially important things are, such as support services and those which we'll be providing through family hubs as we go forward, etc. How the collateral services are so crucial, regardless of how idyllic the circumstances. People look for that sort of support elsewhere. I suppose that's one of the things it tells us. So before we go to the recommendations, I'm going to open it up to questions, and previous midwife Caroline Ellis, Councillor Ellis, I'm going to go over to you.
Thank you very much, Chair. My question is, are there any figures on the maternal deaths due to COVID? Because I was at a wedding and I was quite listening to people, how many mothers were in intensive care and what possible deaths we'd had over COVID, and had that increased in the area, within Nottinghamshire.
Last I heard, there was something being looked at nationally in relation to that, but I haven't seen any specific findings as yet, but happy to follow up. That's okay.
Just an interest to see whether our numbers of the number of mothers we've lost actually increased during this time because of the problems that people had accessing services.
Yeah, happy to take that to have a conversation with our maternity team.
We'll get back to you on that, Councillor Ellis. Dr. Tennant.
Thank you very much for this report. It's very comprehensive, and I agree with all the recommendations. I just wanted to go a bit further on recommendation number 5 on childhood development, and I agree from the observations regarding the impact of children born around 2020, the speech, language, and communication needs. So for me, of all the recommendations, this seems to be the one which is most time sensitive, because there's a very small window of opportunity to intervene, identify, support, and address those needs. I know in page 111 there is a welcome toolkit which has been piloted, and the discussion about the Contain Outbreak and Management Fund. So I've got 2 questions, or just 2 comments essentially. One is, do we know how effective and if the uptake of these pilots, and if we know they are showing some positive outputs, how can we scale this quickly? My second one is about children born around that time will be entering school in 2024, 2025. What have we communicated, or are there things with regards to school for the teachers to start identify, and again very similarly, because that support will need to be ongoing for a few years, because development happens at rapid pace, and I think the earlier we pick it up, otherwise it will have long lasting effects on those individuals. So those were my 2. Thank you.
Thank you. So in terms of the intervention, so we've been successful in having some additional funding through the COVID Outbreak Management Fund to put some additional capacity into both our targeted and our specialist speech and language therapy services, and they're going to work very much at the children who are now aged between 2 and 3.5 to look at exactly what their needs are now and where those needs should be best met. So looking across services rather than being restricted by the limits of the services. In our early year settings, they're delivering lots of interventions. So they've got a new pilot, which is a Welcome pilot, where they work very differently to identify early language needs as early as possible and put strategies in place. And then those early year settings are actually work very proactively with schools around that transition as children move up to reception and onwards into school. And I think schools are recognising those challenges around speech and language needs and putting in place kind of interventions locally and support in their schools.
Thank you. Councillor Wilmot. Thank you very much, Chair. And thanks for all the information. It's been rather enlightening, to say the least. And as I read through the report, it became more depressing, as far as I can see. The negativity that this conflict of the pandemic has caused will take many years to put right, and there's no doubt about that. And we can only hope that people continue to and continue to help in any way they possibly can. And it's going to take a lot of hard work over the next few years to get things absolutely right. It has been a very, very serious complication for many families. There's absolutely no doubt about that. I've seen family relationships destroyed because of it, and almost been in tears just seeing some of it. It's caused mental health problems, and it says that 81% of the pregnant women and their carers were impacted in a negative way, and 80% of parents were saying it's created a negative impact on their mental health well-being, which we all know is true, because people are suffering out there and still suffering on the situation. It's going to take a lot of hard work from a lot of good quality people to help in any way. Many mothers, of course, have said that they were experiencing trauma through the perinatal period. And if you've experienced that, and probably some ladies here have heard of it, or if they haven't had that sort of situation, it's a very serious problem indeed. And I just hope that these people experiencing long-term implications from that time just do get better. And it really is a serious. It's good to see extra work going on, especially in strengthening mental health pathways. I've seen some of the work that's going on myself, and it's excellent. And reviewing and enhancing the local antenatal and parenting program, and preparing and empowering parents for parenthood. As far as we go back to the children, impact on children's development, with local professionals are saying that it's a large percentage of children have struggled with social and emotional development, children's communication skills and children's behaviour. Well, it's some time ago some of the child services were taken away, and we now know that was a wrong thing to do, but we didn't know that this COVID would arrive in such a terrible situation. But we've got to get some more child services out there to help with all the problems that some of our children have got. Children in the 2 to 4 year age bracket had a decline in the expected level of development. Again, that's child services are an essential part to try and alleviate that problem. And we've got to look at that to make sure that every child gets the opportunity to learn the necessary things that will help in their in their behaviour and also learning possibilities. Can I also say that all in all, this pandemic has a lot to answer for, and it has put development of the country and families back by many years. But looking at the report, there are many initiatives taking place which I think are excellent, and but hopefully the lives of everyone can improve, so that happiness can once again come to some people who are not having happiness at this present time. Thank you, Chair.
We welcome the return of happiness, Councillor Wilmot, and clearly in all of the COVID impact assessments that we'll be doing domestic abuse. Sorry, Vivian, you're going to bring. In all the COVID impact assessments we've been having, from domestic abuse through to the lifestyle challenges of drinking and alcohol and obesity, etc. They've all highlighted the number of years that we have to try and redress, and of course that's the whole reason for having the COVID impact assessments, etc., and the whole reason for outlining how we're going to deal with those challenges. And indeed, in a few minutes, when we go on to the best start strategy, we'll actually see some of that coming on. So before we go to the recommendations, I'm just going to go to the Deputy Director, Vivian Robbins.
Thank you, Chair. And first of all, I just want to say a real big thank you to the team for an absolutely fantastic piece of work. Really, really well done, well presented today. So thank you for that. I think one of the things it really highlighted for me is it takes a community to bring up a child, and unfortunately during the pandemic our communities were not able to connect in a way that we would have wanted them to. And I think there's something for me around some really great recommendations here around how we can make sure that we support our communities, and think around how all of us individually can support that community development in bringing up those children. As we know, the evidence base around the first 1,001 days is so crucial, and you can predict where a child is going to be in 20 years' time from how those first 1,001 days are. So great work on that. I think the thing for me that I just wanted to highlight here, though, is we've been quite lucky in terms of things like vaccination rates and things like that have stayed fairly well. We've still got work to do around particular vaccinations and things in terms of things like MMR. But one of the things that I really wanted to highlight here is the equity angle, because the people that will have more resilience are more likely, I'm not saying definitely, but more likely to be in our least deprived areas. And actually, I think one of the things that I'd be really keen to pick up on and link into the Best Start strategy group is really understanding the inequalities. Because I think what my concern would be is we've got that group of children now that have had a significant impact from the COVID pandemic, and what we don't want is the outcomes for those to differentiate more than we are already seeing in terms of our health inequalities angle. So I just think if there's something we can think around in terms of how we can strengthen that, I would be really keen to see that. But I think the other thing for me is I'm really pleased to see how the Best Start group has taken on these recommendations. I think that shows real strength of partnership, and many of you will be already involved in that partnership. But I am really keen to see how we are moving on this. So, how we are going to get that feedback back from the Best Start, and that will come on to the next agenda item. But overall, really, really good job. So thank you.
Thank you, and thanks again to Lucy and Helena for an extraordinarily comprehensive document. I'm going to move on to the recommendations, as further questions will probably be met in the Best Start Strategy Progress Report, which is coming up, and may well have from Councillor Wilmot an elucidation of the family hubs which are taken over from the Children's Centre, and the increase in facilities and the age range as they go right up to 19 years of age as they get rolled out across Nottinghamshire, and I'm looking forward to that. The recommendations to the Health and Wellbeing Board are to establish any actions required by the budget in relationship to the finding of the COVID impact assessment, and to consider how members of the board can support the implementation of the outlined recommendations set out in the COVID impact assessment. I'm going to propose that. I'm going to ask Dr. Tillen to second it. All those in favour? Excellent. So we're going to move on now to item number 6. Now, item number 6 is almost a sequel to the previous one, looking at the Best Start Strategy actual progress. I think a lot of the time we have spent the last year bringing you forward strategies, and we've made it an absolute point that we not only deal with strategies, but we deal with the progress reports on the implementation of those strategies on a regular basis to show how we're implementing them and what they're bringing about in terms of change and improvement. And in terms of the Best Start Strategy, Irene and Kerry, could I pass over to you?
So thanks, Chair. We're very happy to be here today to with Irene to present the Best Start strategy update to the board. So the implementation of our Best Start strategy began in 2021. So this is the second annual progress report that we're actually bringing to the board. Since initiated, the Best Start strategy is now included in the health and wellbeing, the overarching health and wellbeing strategy and the integrated care strategy, and several place-based plans across the county. So, on behalf of the Health and Wellbeing Board, the Best Start Partnership acts as the responsible body for the development and the delivery and the performance of the Best Start strategy. So, we have a very strong partnership board that actually oversees how we implement this strategy. So, we have 10 ambitions within the Best Start strategy, and many of these ambitions actually have an action plan attached to them that is delivered by an associated Best Start Partnership subgroup. So they're all divided into each individual piece so that we can actually monitor progress against each strategy item. So we'd like to briefly talk you through the progress we've made so far. You can see that there's an infographic on the screens there that just highlights a few of the things that we've actually achieved in this last year, and then we'd like to talk about our next steps in terms of the strategy and welcome Health and Wellbeing Board member input to see how we can collectively further the work on the strategy and achieving the ambitions over the remaining years of the strategy itself. So I'm going to hand over to Irene, who's going to give you a little bit of information on the progress so far.
Thank you. Yes, as Kerry said, there is an infographic for you to look at, and the information around the ambitions and the progress is actually in paragraph 12 of the paper. There are over 30 items in the report, and there's double that in the appendix. So there is quite a lot for you to read. I apologise. So what we would like to do is just focus on some of those key progress items as well. We'd also like you just to consider if there is any promotion you can help us do as well in terms of the infographic, if that's something that you can cascade to colleagues. Kerry,
so because there is so much, I don't know if I've turned this on or not, sorry. Yes. Because there's so much in the actual appendix and in the report, we've been very selective about highlighting some of the key successes. The first one that I wanted to talk about really was one that's already been identified. You heard from my colleagues around the COVID impact assessment and particularly around speech and language, and we have touched a little bit on the COM funding that we've achieved for speech, language and communication. And this funding will help us to support children who have been identified more recently as requiring more input in relation to their speech and language, focusing particularly on children that are over that 2.5 years of age. So probably are in that cohort that we were talking about that are due to start school fairly soon. So it's quite important. In addition, that funding also covers some specialist speech and language input, which will help us with particularly autism assessment, because there is often quite a significant waiting list around autism assessment, and we are very aware that there are an increased number of children that are now waiting for those assessments. So that funding will help us with that. And the Best Start strategy partnership group will actually oversee the implementation of that and monitor the progress of it. The other area that I'd like to identify on the infographic is the top right hand purple box, which is the Sherwood Forest Hospital Phoenix team, and they have implemented a project where they are ensuring that that we increase the availability of smoking cessation services and actually have an element of incentive. So that's been very successful, incentivising the smoking cessation. And the impact of that basically is that we're ensuring babies that are in utero, they're being protected from the harm and the harmful effects of prolonged smoking. Then the other area that I'd like to identify to you is elsewhere on the infographic, but it seems to have gone very big. So there we go. So in terms of the purple box on the right hand side, I'd just like to introduce you to a new initiative that's been introduced following the information that we've had again from the COVID impact assessment in part, which is a targeted parent-infant relationship intervention that is being piloted within the Healthy Families programme. So following initial assessment of parent-infant interaction, we have a service in place now where parents can be referred into this service if if the health visitor at the time identifies that there is a potential issue with parent-infant interaction. Over the course of the last 22-23 year, we've had 109 referrals into that programme, and the whole purpose of that programme really is to work with mums and babies in order to be able to improve that interaction, because we know that early bonding, early attachment is so vital to future life chances. So they're the ones that I'd like to identify, and I think you've got a few too.
I will, yes. Thank you. So just a few really to pick up. There's one on the top left, light blue, half a brain, half a heart. You can probably see that image. And that really discusses the work that the Children's Centre Service has done in terms of supporting emotional health and wellbeing. They run groups called the Few Groups. Statistics on the infographic show 94% reported improved mental health, 33% felt closer to their child just from that intervention. And there have been 650 referrals into that this last financial year. The other thing that we're very proud of is around children's development. So the children that have finished first reception at school, 67% of those actually achieved their the developmental outcomes that we expected. That is the highest value we've had in Nottinghamshire. It's always been a priority for us in terms of school readiness, and we are now higher than the national average. So we're very pleased, but obviously there's a lot to do in terms of inequalities. Children who are entitled to free school meals in certain areas of the county, we still need to do a lot more in those.
So if I can just pick up one of the questions you had earlier about Healthy Start before we move on to next steps. In terms of Healthy Start, you identified that we've got some variation across the county, and we absolutely have. So in Nottinghamshire, the overall uptake is 67%, and that's actually higher than the national average, which is 65%. But we do have that variation. We have a very high uptake in Broxton of 73%, and closely followed by Ashfield, and then a lower uptake in Rushcliffe of 61%. So in December of last year, 2022, funding was agreed by the local maternity and neonatal system to fund vitamins, which is part of the Healthy Start package. So to fund those vitamins universally throughout pregnancy. So now all women in pregnancy will receive the vitamins. So there's no eligibility linked to that anymore in Nottinghamshire. And they do include the really core vitamins of folic acid, vitamin C and vitamin D. And we've implemented that from the 1st of April of 2022. So it's for all women accessing services from Nottingham University Hospitals and from Sherwood Forest Hospitals, and we are working with Bassett Law to ensure that we have an equitable service in Bassett Law too. They sit within a different local maternity and neonatal system, which makes it a little bit more complex, but we are working with them to ensure that happens. In terms of the actual promotion of this, so the Children's Centre Service and the Family Information Service continue to promote the Healthy Start scheme across the board really, and other key public health messages are regularly sent out via social media, and over the last year apparently that reached, I'm going to take the word for the figures, 88,000 people received those messages and read those messages around Healthy Start, but we recognise absolutely that there is more to do around this. We do have a fairly good uptake in Nottinghamshire, like I say, compared to nationally. It isn't a local problem necessarily, it is a national problem, and I think some of that is around the assessment of eligibilities, particularly for the food vouchers, and how we actually work on that. But we're hoping that moving forward into the next 12 months, that's something that the Best Start partnership will definitely run with and take on board. Okay, so if I just move very quickly to next steps, is that okay? Yeah, it will be very quick, I promise you. So we do recognise that we've got plenty of work to do over the next year or the next remaining years of the strategy. The report details on pages 124 and 125 of your pack, different to my numbers, of your papers, and the things we wanted to particularly note were the Family Hubs rollout and publication of the Best Start offer. We need to improve our data capture and work on our information sharing agreements, and we want to really address those COVID impact assessments and the recommendations through the Best Start partnership group.
Fantastic. Thanks very much to Irene and Kerry. And it's exactly the type of follow-on that we needed from the COVID impact assessment and the detail, etc., which is enormously encouraging in that sense. I love the idea of the free vitamins being rolled out. Obviously, folic acid. There's 1,000 babies with neurotube defects born per year in the UK. Many with anencephaly with no brain. They just don't survive; they die. And simply folic acid could reduce at least something like 80% of those. I've personally had feedback from the Phoenix team in Sherwood Forest Hospital, being the governor at Sherwood Forest, and it recently reached number 101. I think for 101st woman who was pregnant who had been smoking. I was most impressed by the fact that they don't just look after the person that's smoking, they look after the people that those people live with. So if you don't treat the other people in the house that smoke and try and reduce smoking within the household, then it's more likely to fail. And I thought that was an extended arm that made it quite successful. So I quite enjoyed that. So I think that's it's very upbeat. Does anybody have any questions? Yes.
Hi, thank you. Excellent report and fantastic work. I just got to go back to Viv's point really about it takes a village to raise a child. And we'll come on to the Joint Forward Plan later, which has the principles around prevention, integration and equity, which I think we've kind of alluded to. And it'd be really good to think about what are the opportunities around how we lock into place-based working, making sure that every contact counts is absolutely threaded throughout here. And we really do aspire to work in that cohesive way where those key strategic priorities, integration, prevention and equity, are really spread out through all our strategic and operational plans.
That's music to my ears. It's one of the areas of work we're looking at the moment. So place-based partnerships are represented at the Best Start Partnership, and we're looking at the moment at what existing governance arrangements each PBP has. Helen's nodding because we've been talking about this week, and looking at can those groups have a lead role around Best Start. Mid-Knots has already got setting up a dedicated Best Start group. Newark and Sherwood has already got a Best Start group. Mansfield and Ashfield are doing the same. So we're looking at what else we can do, but linking into the governance arrangements that already exist. The other area of work that's mentioned in the report that we've not verbalised today is around family hubs. Family hubs have to be in the communities that really need it. So we're looking at areas of deprivation, but obviously working with the PBPs, the district councils, to really drill down where are these priority neighbourhoods, what's going on in those areas, and what can we do. And the development of family hubs is one of the ways that we want to implement all of the recommendations from the COVID impact assessment, from the Best Start strategy. So we are looking very much at inequalities, whether it's at target groups, but certainly locality is key, and PBP partnerships are absolutely key to this.
Am I right in thinking we've got one family hub at the moment?
Yes, we've got one family hub in Retford. We're rolling out the next two. Ashfield, certainly in Ashfield will be one. Hortonville and Newark and Sherwood will be another. And we're looking also at Oak Tree in Mansfield and another field in Gedling at the moment, with wider plans to roll out over the next 6 months.
And these are physical properties which people can go to. They're not virtual, they're not in the ether, they're real places.
Well, it's a mixture. So each family hub network will have a main building that's open every day, a real hub of activity, but there'll be a range of different satellites as well. So some of those satellites might be in a library, they might be in a health centre, they might be in a children's centre building, and that's how we really want to drill down into those neighbourhoods as well. So it's going to be a mixture of virtual and physical. Virtual being the virtual family hub offer, which is going to be online for universal families. Families struggle to find what services are available. Professionals struggle with that as well. If we have them all listed on a directory through a virtual family hub, that helps, and that's certainly what families want as well.
Okay, I'm going to go to Councillor Place first, yeah, and then Councillor Tideswell.
Thank you. Are you going to use all Sure Start premises to do this? That's one question I wanted to ask. Have you any ideas when it'll be rolled out with the rest of Asset Laws?
Absolutely. We are using all of the children's centre buildings, and we will be rolling out next financial year. So there are plans in place to do lots and lots of co-production work with local families and stakeholders this financial year, with rollout from April next year.
And Bassett Law's next, is it?
Well, Bassett Law's had the first family hub already in Retford, so
Okay.
it will be in April that we'll do the next one in Bassett Law.
Okay, there we are, Sheila. Councillor Tideswell.
Thank you, Chair. Yeah, I agree on making things accessible and local for parents to get to. But there is the recommendation that came out of central government a couple of months ago, whereby they were wanting to put everything in a one-stop shop system, which we talked about, didn't we? And I understand the advantage of that, especially in certain deprived areas, so they didn't have to go up to Eastwood or go down to Hucknall or go down to get the advantage. But there is an advantage of making sure professionals are joined together, health service and social services especially, because we talked about it in another one where, you know, we've got the situation now where health service do no longer provide a free operation for children that are born, or the babies that are born with a tight tongue. So parents have now got to find £300 from somewhere. Unfortunately, in certain areas, parents can't just come up with £300. So this still needs readdressing and looking at, because that is the health service side. That is the advantage of places like early learning centres, because you've got did have health service and social services working together in harmony. And I still feel a little bit cynical, but yes, we do need certain things locally, but we do need a one-stop shop where mums and dads can go and say, "Oh, can you help me out with this? Can you help me out with that?"
Thank you, Councillor Tideswell. Personally, I wasn't aware that the tongue-tie surgery services had been abandoned by the NHS. I know a lot of people have access through the breastfeeding clinics, etc. I've had a number of patients with tongue-tie who've had releases on the NHS. I've had a number of patients who've gone and paid 200 quid to have done privately for that point of view, but I'm not aware of the removal of tongue-tie services. What is a challenge is often negotiating your way through the pathway in order to get it, and that's the challenge that I always see. I run the baby clinic at the surgery, and the challenge is for people knowing how to get the tongue tie released, and that's what, when we spoke locally to practices, a lot of them had no idea that the service actually even existed. Dr. Short, ICB, do you have any idea what the status is on the tongue tie service for the tongue tied children of Nottingham? Yep. Yep. Yes. So I think it's negotiating that you could ask a lot of people how to get there, and they don't know because they'll only come across one a year or one every 6 months. But my understanding is that it still exists if you can go through the right door. I'm getting some nods there.
Yeah, it does. So there is still a tongue tie service at Sherwood Forest Hospital and at Nottingham University Hospitals for babies, particularly in relation to breastfeeding, for babies that require that tongue tie release.
And that type of information would be crucial to come through family hubs and things like that, to be on the virtual websites, etc., easily accessible. So this is a sort of the type of thing that we want to get out there, and this is probably the vehicle which is best achieved by. Okay, I'm going to go. Oh, sorry. Well, just Sarah.
Thank you for that. Obviously, in the recommendations and the ask that you've got for the board, you're looking at opportunities where members can add to this and support it. Can I just ask where parents and carers are engaged in all these different elements? Obviously, Health Watch, for the new members, my name's Sarah Collis, I'm chair of Health Watch, which is a statutory member of this board. We offer
for, it might be an opportunity for us to work together, but I would like to know where parents and carers are being engaged. You mentioned there's going to be some co-production. Obviously, this is a strategy that's in place. So how have parents been involved in building this strategy, and how are they going to be engaged going forward?
Yes, they have been engaged. So we started off really with consultation work, and then we've done a lot more co-production work, and they are different. It's very much on an equal footing in terms of families being involved in this. So as part of this work, we did complete 2 needs assessments, I feel like ages ago now, which developed the Best Start strategy where families were involved. And I'll just give you the example of the first family hub in Retford, if that's okay, as co-production. Last week we got published as an example of good practice for the work we've done in Retford around co-production with families, parents, young people and stakeholders. That co-production has led to a number of different ways of working in that area. It's led to particular services being engaged. There's a lot more about young people's mental health now in that family hub, because that's what families want. We know that a lot of families want peer support if they have children with special educational needs. So we're looking at setting those up in Retford. And again, it's a recurring theme that happens quite a lot. So that's something we want to try and offer through the different family hub rollout mechanisms. And we also work with an organisation called the Parent and Carer Partnership, which is parents who have children with special educational needs and disabilities. So it's absolutely crucial that we have the voice of families involved in decision making, delivery and evaluation. One of the examples that's in the report, in fact I think there's a couple where we use local parents as peer supporters around breastfeeding, around emotional health, and volunteering is absolutely critical to the current children's centre service and the family hub service going forward. But we would absolutely love to work with you, Sarah. And we've already got links with the Maternity Voices Partnership for South Yorkshire, but also for Nottinghamshire.
Thank you. Helen Smith.
Yeah,
Thank you.
just reiterating Victoria's point, but also picking up Viv's point earlier around equity of access. So it's just a question in terms of the few groups. You've got some really good stats there, really high stats, but have you looked at the people that haven't attended, and are we making sure that there's a good mix of people accessing those services and it isn't just our usual cohorts that are attending there? And similarly with the emotional health leaflet, was that co-produced and developed so it's accessible to everyone from a health literacy point of view and from a language point of view? Thank you.
Good questions, thank you. Yes, we always look at equity of access. And interestingly, I know we talked earlier about the COVID impact assessment, and some people quite valuing virtual support and others not, depending on what the intervention is, who the family is, and so on. Few was an interesting one, these groups, because actually we found when it was COVID that the virtual groups worked quite well in terms of engagement and that equity of access, but the outcomes weren't always the ones that we wanted from that face-to-face peer support. So there's a mixture of those sorts of things going forward now. We also engaged fathers quite well delivering the virtual groups after work, even lunchtime sessions and things like that, which we are looking at. There's always more for us to do. And working with the place-based partnerships and district councils, we want to delve deeper into the data so that we know exactly who we haven't reached and look at how to reach them. One of the key areas is to work with healthy family teams and midwifery. They're universal services. If they come through universal service, those services really need to be flagging up issues and trying to encourage people into the children's centre, then family hub services that we've got available. But there's a lot of services, there's a lot of activity going on. Our priority at the moment is to integrate some of that, to share the same data, target the same families that are accessing at the moment. And in terms of the leaflet, yes, co-produced with families. There's always more we can do around access as well, and different languages, and it varies depending on where you live. So we do need to do more on that, Helen, I appreciate it. Thank you.
Councillor, we'll go for one last comment to Councillor Wilmot before we go to recommendations. Councillor Wilmot.
Thank you, Chair. Obviously, it's an excellent report. My only problem is all the work. Can we cope with all the work? Because normally what you do is you prioritise a number of issues to make sure that they're working first, and then move on to other issues. But this seems to be all in, chuck everything in, which I'm pleased about, because everything's relevant, but it's going to be difficult. That's what I'm saying. The information must be got out there. You must involve the local communities, the schools, especially the head teachers. They are the decision makers in schools. The voluntary sector, huge voluntary sector in Sutton and Ashfield. Getting involved with those, and people forget the faith groups. I mean, I'm a churchgoer, but some of the churches I go to, I also go to others as well, just to get to know what they feel about. Some of them have a congregation, hundreds, and so there are people there that would benefit from being to know all about what's going on, etc. Can I say that? Yeah, many families aren't on don't look at websites, and especially the ones we're trying to meet or talk to. And as I say, they don't go on websites because they can't afford to go on website. So there are other avenues that you have to look at: newspapers, leaflet drops. It's expensive, I know, but the leaflet drop does get through to every person, and that's what you need to do. But well done for all the work you've done. It's a fabulous paper, and the other issue is progress. Some of the issues you're just moving into it. I would love to know what the progress is in 6 months' time or 3 months' time, or whatever you feel is appropriate to come back to the Health and Wellbeing Board to let us know what's going on. Thank you.
Beyond no illusion, Councillor Wilmot, the progress reports will keep coming one after the other, and that's the whole point, that we're moving from strategies to actual instrumentally putting things in action and then doing the reports. And although sometimes it's a little bit worrying when you see an awful lot of activity going on, it's even more worrying when you don't see any activity going on. So I would far rather be in that big stew than sat alone with very little going on. I think it is very inspiring. I think it's very hopeful for the future, and the family hubs and the points of access and the distribution of information. It's the way forward. It's the only way we're going to win the battle. And I thank you for the report. I'm going to move to the recommendations. That the progress made in delivery of the best care strategy is noted, that the next steps for the effective delivery of the best care strategy set out in the report for improvement of the outcomes for children and families, and to consider how the board members can support the best start strategy going forward. I move to report. Tillon, could you second?
Yes, Chair, seconded.
All those in favour? Fantastic. Thank you very much. Excellent. Now we're going to move on now to another progress report. Councillor Wilmot, 2 progress reports. This is another progress report here. It's on the Joint Health and Wellbeing Strategy. You'll be aware that the Health and Wellbeing Board is a dynamic board. It's a board, I first joined it in 2012, some 11 years ago, when it was established by the then Secretary of State for Health, Andrew Lansley, and brought into its statutory function. And there was a statutory list of members which had to be there, and others which you could bring in as need be. There's been no greater change over the last couple of years than the last government white paper in 2022 establishing the integrated care services and the roles of the ICP and the ICB, and indeed how they feed through into the goals of prevention, reducing health inequalities in the system, and in particular, many people here today represent place and how we feed through the ICB, feed through place down into primary care networks to establish what we want to do. Part of that means being dynamic, part of that means incorporating people onto the board who represent the organisations, voluntary or otherwise, that we need in order to deliver on strategies such that they become actions and they become things that we can look at progress. And with that in mind, I'm going to ask Bryony Jones to give us a progress report.
Yes, afternoon everyone.
So what I will do is I'll run through the progress report very quickly. I'm conscious of time, but it very much is highlighting how we have put in some new structures in place to support the delivery of the health and wellbeing strategy. So it's more about how we're delivering as opposed to the sort of impact of the strategy per se. So I'll just very quickly bring up a short number of slides. Perfect. So the first new structure that I wanted to highlight to board members is that we have actually set up a steering group to oversee the delivery of the health and wellbeing strategy. This brings together sort of key members from the board, so our 3 place-based partnerships. It also brings together key officers from the Nottinghamshire County Council, from children's, from adults, from public health, and we're also looking at bringing in a new member from the chief executives. So that's very much to be acting as an engine room, if you will, of all the key partners to be able to coordinate that sort of action where it's required, discussing or identifying opportunities for joint working or joint bids, for example, with the recent Health Inequalities and Innovation Fund. So we thought actually bringing together some key partners outside of the public meeting would be a really beneficial way to further progress the health and wellbeing strategy, but also system working on other priorities and action plans. Following that, we've also started to develop a prototype of an outcomes dashboard. So each organisation will have some sort of data or intelligence function. What we're proposing for the health and wellbeing strategy is we choose a number of really key indicators that we can measure the outcomes for our residents in terms of, are we delivering the rates of smoking cessation that we'd like to in the county? What's the breastfeeding rate across Nottinghamshire? And we've also been very specific in choosing indicators that we can break down to a district level, to a place-based partnership level, acknowledging the points that have been raised today that there are inequalities within the county. So as helpful as it is to compare our performance to the national average or Derbyshire's average, for example, we actually think having a live dashboard that we can use to compare our performance within the county would be really helpful. And again, this is an ongoing piece of work, acknowledging that there are various other strategies and other pieces of intelligence data that are being collected. So again, we're really keen to pick some indicators that can suit as many partnerships and as many strategies as possible to promote that system working about maximising oversight and coordination of action plans on these particular priorities of the health and wellbeing strategy. In a similar vein, you'll notice today we tried our best to theme the board meeting and its work programme around children and the Best Start agenda. And I think hopefully that's been really helpful to sort of strategically focus discussions on any gaps in provision, any communities or localities that we need to be focusing on, and also understanding, what progress are we making to deliver better outcomes for our children and young people. So again, this idea of a quarterly themed meeting on an ambition or a priority is something that we're going to be doing more of moving forward, to kind of create ourselves a robust structure to be understanding the progress made to deliver better outcomes. And again, it's not something new, but it's something we're going to be more strategic as we're moving forward. So on this screen is a very high level summary of what is the foundation to our joint health and wellbeing strategy. And the ones that I've highlighted are actually priorities and ambitions that we've already had themed workshops or themed meetings around, just to give you a bit of flavour of the fact that actually a lot of our business as usual is about delivering the health and wellbeing strategy. And what we're proposing is to be more considered and focused moving forward about how we discuss progress. So today was about Best Start, but in the past we've had workshops on tobacco, and we've done a lot of joint working with Nottingham City, and we have a tobacco declaration. Again, mental health, we've had a workshop previously in the past on mental health, and they've actually just recently been in touch and would like to do a follow-up workshop with board members on suicide prevention in 2024. And then again, similarly, in the efforts of focusing discussions, September's board meeting will be around that keep our community safe and healthy ambition. So we're going to be having an update from the Domestic Abuse Local Partnership Board. We're going to be having an update from the new Substance Misuse Partnership as well. And we'll have an update on what we're doing around homelessness, because again, we had a workshop in homelessness in October through the Health and Wellbeing Board. So it's about bringing together all the ongoing work programmes and areas of work around the strategy, but to allow board members to, as a whole, see progress and delivery of it on a particular ambition or priority. And on that, I would welcome if any organisations or board members wanted to add to the work programme. I think we'd really like to update board members on what we're doing around food insecurity, for example, then please let me know and I can find a meeting or a workshop slot that would suit. And then this is just to highlight what the outcomes dashboard will look like. I'm really keen to highlight that it's a work in progress because it's a new area of field for me. But what we're hoping to do is for it to be live so that people can pull the reports that they need. We will also obviously share this quarterly with board members itself. And what it's looking at is comparing our performance against England, comparing our performance in the past. Are we getting better? Are we staying the same? Are we getting worse? And then also we'll start to add that comparison towards districts and sort of neighbouring local authorities. So again, we can have more strategic discussions about where we might need to do a bit of focused work for this particular community or for this particular locality. And then very finally, some next steps and how we're going to be sort of further strengthening our structure towards delivering the health and wellbeing strategy. We're going to continue to have these themed meetings and these themed workshops. We're going to finalise the outcomes dashboard and share it with partners, and hopefully it will be a useful mechanism for themselves in terms of understanding performance in particular priority areas. And then again, for example, we have the Best Start partnership, we have a Best Start strategy. They have 10 ambitions, all of which have work programmes and action plans. So there's a big ongoing bit of work about coordinating this and how can we best share it with members so that we're not duplicating and actually we're maximising what each partner is working on. And then the last action is in response to a latter report this afternoon about reviewing the Health and Wellbeing Board. And again, I think understanding how we deliver our health and wellbeing strategy will be a key way about how we promote the Health and Wellbeing Board in the local health and care system. But I will stop there, happy to answer any questions, but that was it in a nutshell.
Briley, around the dashboard, we currently have the Public Health Outcome Framework, which reports on a quarterly basis on over 200 indices with Nottingham compared with the rest of England. Am I right in thinking that this is like a narrowed down version that just looks at our strategic objectives for what we've decided are our strategies? Is it as simple as that, or is it different?
No, it is as simple as that. So we've used the Public Health Outcomes Framework. So as Councillor already said, there's 80 odd indicators that you can look at nationally or more locally. So we've chosen ones from that list. But what I would like to assure board members is it is aligning with what has been proposed for the integrated care strategy in the FOF indicators that are going forward for that particular monitoring purpose. So it is simple, but it is being mapped across other sort of performance reporting metrics that are being proposed at a system level.
And the other thing to say is that in terms of the number of meetings that we have as a Health and Wellbeing Board, it is probably at least 50% more than the next local authority and others. So it's an exceptionally dynamic board in terms of the number of meetings and the mixture of workshops, which take a lot of effort and time, but are very, very productive in their output. And obviously with the new subgroups now, that will certainly add to it. Particularly any of you who've just recently joined it, it's quite a challenge to get round to most of the things that we do, but ultimately very rewarding, I would say. Any questions, Councillor Wilmot?
Yeah, thank you. Thanks for the report. It is a good report. It's giving the information that we do require. Can I say I'm overjoyed that the board has appointed the chair of the Voluntary Community and Social Enterprise Alliance for Nottingham and Nottinghamshire as a permanent member of the board. I hope the newly set up Joint Health and Wellbeing Steering Group works well as a partnership, and it can help with the problems that the people of Nottinghamshire are having at the moment in getting services that have serious problems areas. It's good to see that it will be working with the local communities. Can I say, after all, you know, who knows better than the communities out there what is needed? You know, rather than officers. It's a difficult situation to put officers into making decisions when they haven't worked with the local communities or the voluntary sector and all the necessary people you have to get in touch with to get to know the actual work that's going off, or is it working correctly, or is it not working at all? And, you know, it's good to know that we are working with these organisations. I'm pleased to see that only 4 priorities have been selected. As I said at the last one, they put a lot of things on the items on the agenda to get to. And is it a lot? I think it's a lot. But yes. I'm hoping it all works. But having 4 priorities, it really gets to the nitty gritty of the situation. And hopefully all these 4, working, the 4 priorities that have been selected will be scrutinised and they'll be focused upon one at a time. And say, look, I'm looking at the indicators we have to work to do on living independently. We really have to work on that. Best start in life: obesity, smoking in early pregnancy, smoking status at times of delivery. All these things could come to before in the 4 priorities, and they need a lot of work done on them. But I'm happy that I think I'm pleased to see that the strengthening of working with partners on prevention is been put forward. I think prevention is far better than actually tackling the problem when it's occurred. Far better for it never to happen. And I think that's absolutely.
Wilmot. The rest of the country has finally caught up with you and agrees prevention is the best strategy.
Well, I've been going on about it for long enough.
I started medicine in 1985 as a doctor, and the same diseases are killing the same populations since then, be it smoking, be it alcohol, etc. The same problems are there. But the ICS has been mandated with prevention as a necessary part of its agenda, and to allocate a percentage of its budget in order to achieve that. And we all know that the most expensive service you can have is the one that reacts to illness and treats disease, as opposed to the one that prevents disease. But this is the first time that I can remember that people have openly and outwardly said we must spend a percentage of the money on prevention, as opposed to it being sort of just like an add-on if there's any money left over. So it is a number 1 priority, and you're absolutely right. And I hope, like the rest of us, that you'll see that progress reported back to you on a regular basis.
There's just one other item I want to quickly comment on: developing and training and retaining the local talent. It is very important. How it's most important is the fact that we've got to make sure that what doesn't happen is that we train these people up to a situation and then they leave immediately afterwards. I know the government are looking at this item as it is, because it is essential that when people it costs money to train these people and so forth. It's essential that they should have to spend some time in the organisation that's trained them.
And not just some time. They should spend some time working full-time in the organisation that's paid for their degree.
Oh, right, okay.
And not start off life doing a day or 2 a week. That's one of the other big challenges. Nobody seems to want to do a week's work anymore. So I think the rest of the country is probably in agreement with you there as well, Councillor Wilmot. So having noted that, we move to the recommendations that the Health and Wellbeing Board note a strategy progress report to establish if any actions are required in relationship to the issues raised, and to receive a presentation on progress made in delivering the strategic ambitions to make sure people are maximising their potential. Thank you, Bryony. I propose that. A second that. All those in favour? Fantastic. Right, so we're going to move on now to number 8. Number 8 is the joint forward plan for the NHS. And you might think, well, we've heard all the joint forward plans and we've heard all the thoughts and we've heard all the ideas, and we'll be going to Joanna Cooper soon. But this is really asking the ICB, or the NHS element of it. We have a strategy, we've agreed a strategy, the city, the county, the ICS through the ICB, and we're saying, how are you going to implement this strategy over the coming years? One thing signing up to a strategy, the other is how are you actually going to do your bit to help it be delivered, particularly when a large part of that, Councillor Wilmot, is around prevention. Right. And I'm going to go over to Joanna Cooper to enlighten us on that.
Thank you, Chair, and you've stolen my introduction. So I'll move straight to saying thank you to the board. So we spent some time in your last development session, and we had a bit of time at your meeting prior to that, where you really helpfully shared your thoughts and views on our developing joint forward plan, building on that health and wellbeing strategy and that integrated care strategy for the wider system. So thank you ever so much for everybody that took the time to participate in those conversations and to provide that individual feedback. It really was appreciated, and it has made a really significant impact on how we've shaped the plan. We took on board feedback from around 800 individuals as we were shaping that plan. So we had some dedicated workshops with boards like yourselves, conversations with organisations, and conversations with the most important people, our local people and communities. We had a survey that was made available to them, sharing some of the key principles from our plan, as well as having that ICS Partners Assembly event earlier in May, where we had, I think it was about 120 people attending from communities and from different sectors in the system. So fantastic engagement in putting this plan together. The documents are now published on our website. We had to publish by the 30th of June. They are still a final draft, but we have the main plan available for you. We have an executive summary and a more public-facing, friendly, easier to read version that's a few pages long that just summarises some of the key concepts within that plan. What I'm here today for is we are fast approaching finalising and agreeing that plan. Our ICB board will be meeting on the 13th of July to agree those final plans, and we'll be looking to publish by the end of the month. Your endorsement of the plan would be really appreciated, and in the report you'll see in paragraph 10 there is a draft statement to include from the board. It'd be really helpful if we can agree that today so it can be added into the plan, just to show that Health and Wellbeing Board are supportive, that the plan reflects the priorities within the joint health and wellbeing strategy and that integrated care strategy. After that, our next steps are that finalisation of the plan and a launch by the end of the month. We've got a few little bits to just look at. There's a couple of typos, I think, Victoria, that we've been made aware of in the draft. We'll be tidying those up. We'll be moving to design, and we'll be having that launch by the end of July. So over to the board. If you have any feedback or any comments to input into that statement, thank you.
Thanks very much, Joanna. It really is when you have an integrated care system that all players within that system are aware of the fact that it is a system, whereas prior to this you would have had Kingsmill Hospital here, university hospitals here, the mental health trust there, the GPs here, social care and County Hall in another place. And they would all be doing a bit, but they would all be sort of at least parallel lines which might have intersected by accident every now and again, whereas what we're actually doing is we're actually trying to create a system where we all know what we're doing, and therefore instead of duplicating work, we're actually enhancing that work by actually having the same people maybe doing different parts of it, so it's going round in a circle. And I suspect a large part of it is that, I mean, the hospitals would never have seen themselves normally as preventers of disease, largely treaters of disease. I think it's a real change that's occurred in the last couple of years that never previously existed in the 30 plus years I've been a GP. I've never seen such a move towards integration. And in a couple of years' time, people will know nothing other than an integrated system. And I say this about public health. Public health moved into County Hall here in 2012 under the Health and Social Care Act. Prior to that, it was in the hospitals. Every public health consultant, Vivian, that's trained since then has trained by going through county councils and knows the importance of public health being delivered through county councils, through communities, into the communities, as opposed to where they used to be based in hospitals. But they know no other system now, and pretty soon the new consultants in hospitals, the new people coming into the system will know no other system other than a single joined up system where everybody works together preventatively and otherwise to achieve the best for the communities in which we live. And that may be a few years away, but it will be an anathema that people ever thought that we all used to work in our own silos and do the best we can and by accident have some results. So I think that's where we're heading in that respect. As the representative of the ICB, Stephen, are you optimistic about the preventative agenda going forward and that we can achieve the spend and the mindset that's absolutely necessary in order to achieve what we want to achieve?
Yes, John, I was interested to hear that you are 1 year older than me.
Yeah, people live longer in travel.
But we've been around together for a long time, and in all that time, whilst we talk about one NHS, NHS has been a coalition of stakeholders who have invariably competitive, argumentative, combative, adversarial on occasions, and meaning that relationships have been underproductive.
Yes.
For the first time in 30 years, and unfortunately for me, at the very end of my career, we have this fantastic opportunity to bring all those with a stake in health and care together and make them jointly responsible for the health outcomes of the population. So I am bullish and very, very positive around this.
And nailed it on the head, as opposed to being competitive and even antagonistic at times, now to be part of the same family. I think that's the beauty. If we can achieve that'd be fantastic. Did anybody have any questions before I move to the recommendations for John? Vivian.
Thank you, Chair. So I want to say thank you to the work that colleagues have done in the ICB. I think I can genuinely say that I think the ICB have taken on board comments from the Health and Wellbeing Board and from partners, and I think that's really strengthened the final version of that. So I just wanted to say thank you for that. I am hopeful as well around the opportunities of here, but the proof is really in the pudding. So there is something for me around how we can think around how the Health and Wellbeing Board moving forward also gets assurance around delivery and impact. So building on some of the comments that we had earlier, Councillor Wilmot was talking about in terms of progress, I'm keen to see the change in outcomes. So, we can get more people accessing X amount of services, but is that really having the impact on the outcomes that we want them to have in terms of having a healthier and happier life and more sustainable life? So I think there is something for me, and I can pick it up offline with yourselves around how do we link in the progress report that we've got around the joint health and wellbeing strategy in with the progress report on the joint forward plan and also the broader integrated care strategy, because we do need to be seeing that golden thread between the progress of all areas, and we do need to constructively support and challenge partners to enable that impact to happen. So I suppose, really positive. Great work. Thank you for everything you've done. It was a big task in a short time scale. But let's move forward to make sure that we are delivering the impact and the opportunity that it can bring. Thank you.
Thanks very much. And health is a state of physical, mental, and social well-being, not just the absence of disease and infirmity, and therefore, as well as physical health, mental health, and our social health, extremely important. The recommendations are to endorse the draft Nottingham and Nottinghamshire NHS Joint Forward Plan to improve the board statement of opinion for inclusion in Nottingham and Nottinghamshire NHS Joint Forward Plan as set out in paragraph 10. I move the motion. Dylan, would you second the motion?
Sure.
All those in favour? You've passed it, Joanne. You got it passed. So, right, we're going to move on now at 3:45. We're moving on to item number 9, which is the Better Care Fund year-end reporting template. Those of you will be very familiar with The Better Care Fund, probably established 2013, 2014, designed to integrate work with health and social care. Previously, NHS budgets could not be spent in areas outside the NHS without special agreements known as Section 75 agreements, and therefore it allowed the NHS and social care and housing to come together to improve care through a Better Care Fund. And every quarter since then we've been reporting to you on how that money has been spent, and also the fact that it has been souped up quite significantly recently by the government, particularly around getting people discharged earlier, etc., and keeping them safe in their own homes. Naomi, where are you? Oh,
Hi, I'm on the
screen.
screen.
You're on screen. Go ahead, Naomi.
Thank you. So yes, this is our 22-23 BCF end of year report. So this is the completion of the national end of year reporting template, which was required to be submitted to NHS England on the 23rd of May, and we met that deadline. So broadly, the end of year report confirms that the BCF national conditions were met during that year and we complied with them. It gives the final end of year spending position, which shows that we were in line with the planned BCF schemes. And it gives an update around metric performance during that year. And then it has a section for us to report any local challenges and successes around integration and delivery of our schemes. So I would just highlight that the metrics in the report. So the end of year report doesn't require us to give detailed data, but it does, as you'll see, require us to say whether we were on track with our locally set metric targets, and we were slightly below target on all of those metrics, very slightly below. So we just missed a number of them with a couple of percentage. So the report that you can see in front of you on what was in the end of year template itself summarises some of the challenges that we overcame in order to be very close to our target but not quite meeting it. So it's just fleshing out some of those for you. So the first metric being number of unplanned hospitalisations from chronic conditions. We've cited that we know that there's work to do around the system knowledge around the urgent community response service and making sure that's fully utilised, and kind of we've got full geographic kind of consistent uptake of that offer, and that's something we've pulled through into our 23 to 25 planning narrative into the next year's plan. And then we've also cited some challenges around providing nighttime provision for Pathway 1 services, and that learning again is embedded within our Pathway 1 transformation, and that links into our forward planning use of the additional discharge fund come through the BCF. And then we're citing some slightly higher than expected average number of admissions to residential care. And then I think the report is saying that we're very close to target for the number of older people still at home 91 days after they were discharged from hospital after receiving reablement care. I think an additional 9 people would have met that target. So the report that was submitted highlighted those areas of sort of challenge and plans for improvement. And then we also just highlighted a kind of strategic feedback around our system working, and we cited the joint carer strategy as an area of success where we'd work together across the ICS, but particularly between health and local authority, and that was informing our recommissioning and improvement of services to support unpaid carers into this year. And then we've cited some of the additional work we've been doing around collaborative commissioning over the last year. And then this year was a new ask in the end of year template for us to give reflection on how the additional discharge fund that was announced in the autumn of 22-23 over the winter period was used, and our learning, and we did that, and that was a helpful exercise because it informed the planning for this financial year where we've had that additional discharge funding again. So it was a helpful exercise to do in terms of this end of year report, to have that additional ask for reflection. And then again, the report in front of you does just indicate there that we've now just completed the 23-25 planning requirements for the new BCF financial year. That was submitted last week. We're awaiting feedback from the national team and the assurance from national BCF team on that. But it was submitted on time, and we think with a continually strengthened narrative around our joint working and our transformation programs linked to the BCF objectives, which are to keep people healthy at home, out of hospital, and to discharge people safely to their own home. I'll stop there. That's okay.
Thanks very much, Naomi. The Better Care Fund, like everything else, it's actually getting a little bit more exciting as more money seems to go into it. For me, it was the forerunner of the ICS, in that it was an amalgamation of the NHS and social care and joint projects. And I thought at one stage it might be expanded to the degree that it would include the whole budget and become like an ICS, but it sort of stayed reasonably where it was until recently, where we've had a bigger Better Care Fund. And we had a workshop on this a little while ago, where we were trying to review our spend within the Better Care Fund, looking at should we carry on with a spend, reduce a spend, or indeed stop a spend where it was just traditionally pre-assigned monies in a transactional rather than a transformative approach to actually the joint working together. And I think we're moving into a period of more dynamism within the Better Care Fund, particularly around discharges and safe discharges, and trying to be more imaginative and creative, and in particular trying to look at ways in which some of those funds, and there's only a very small amount of them that might be available, to work through place-based partnerships to try and improve other areas that joint working would enhance. Have you got any sort of vision on that?
Yeah, so the BCF root and branch review looked at our current use of the BCF as a vehicle for joint planning and collaborative commissioning, and there's a lot of opportunity for us to do more with it. It's a vehicle that we can take a strategic approach to, which we're doing now. We meet the national conditions. We could go further if we want to. We can show that granularity of collective oversight of scheme total finance information if that's something that through this conclusion of the review we want to do. So that's something we need to think about. This year's planning template nudges us in that direction, so it asks us to show scheme lines as a percentage of total funding. It also asks us for certain lines to show output activity, and I know that's not quite where we want to be. We want to be talking about outcomes, but I think it's an indication from national that that this will be a significant attention on this as an integrated delivery tool for us to understand how services are working together. And I think that will seems to be increasing nationally and locally. I think we've got that opportunity, if we want to take it, to look at using it to collectively have clearer oversight of total scheme. So the review looked at themes and subgroups of different activities within the BCF plan, and we could go further within the expenditure plan and show fullness of local authority and ICB funding, which we're not required to do for the BCF national requirements, but that might be something as a system we want to take forward.
Thank you, Naomi. I'm going to ask if anybody has a question. Helen Smith.
Thanks, Naomi. It's just a point around the unplanned hospitalisation of chronic ambulatory care sensitive conditions. and then the response being about the urgent community response. There's such an opportunity before someone even deteriorates to the point of needing that, and I guess it's just how we draw that into this work rather than seeing, you know, that person being in an acute state that needs an urgent response. What we're doing before that, and how can we conjoin what is actually happening into this work.
Fantastic. Now, did I see a hand up? Who's going to answer that question? Sorry, was it somebody going to give a reply to the pre-care care before the urgent admission? Were you going to mention something on that, Naomi, or were you going to pass it back to us?
Yeah, Sarah, I can respond. So I'm just getting used to the team's input to this meeting. It's tricky. Yes, that's a good point. And one of the findings of the root and branch review was that we could have that opportunity of, say, within subgroups around preventing avoidable admissions, you could have collective objectives and outcomes linked to the services we're showing in the BCF plan. So those outcomes are a bit more preventative and then more directly linked to the services. And we can show that more in our planning, our narrative plan around the BCF. We don't currently do that. I'm sure it's in the system. I'm sure we have those services that we assume are impacting avoiding admissions, and we monitor their delivery, but we don't join it together with BCF at the moment. We don't show those. We just measure, like you said, the BCF required metrics, which are very high level and more at the hospital crisis and or admission to residential care end. There isn't yet a preventative metric around BCF.
Thank you, Naomi. I personally like to see a greater use of preventative technology which sort of monitored people's movements, etc. So one person was telling me that they were able to pick up the number of times a person at home went to the toilet, which might have signalled an early urine infection, which might then have led to an admission to hospital. And there's quite a sort of a disjointed approach to remote monitoring, although it does allow for the increase in the capacity of monitoring with a smaller team. I think it's certainly something that I think we need to look at as we go forward. That wasn't a question, Naomi, it was just a comment. I'm going to ask Victoria McGregor-Riley.
Thanks, Naomi. There's lots of potential, as we've said, to use Better Care Fund in a different way. And we've obviously developed place-based plans which are very much aligned, I think, to the outcomes that we're trying to achieve. I'm just kind of wondering what's the next steps, because in the same way that Helen's just highlighted, I think a lot of what we're doing needs to be stitched together as a whole pathway of care, from prevention and integrated ways of working to acute support and episodes of care, to then readmission avoidance, etc. So it's kind of how we're bringing in the whole person centred approach to the use of the Better Care Fund. So it's not something that's sitting somewhere else, but actually part of the whole package of the way that we are supporting patients and communities and people. So I'm just wondering what's the next steps, really, of really embedding the use of the Better Care Fund. How do we use the opportunity, for example, of the place-based plan, the development of the Health and Equalities Investment Fund money, and the development of integrated neighbourhood team working to do some of those things that Councillor Doddie's just mentioned about Internet of All Things? Some of those technologies, for example, how many times people use a kettle, will be quite important as part of things like that. So there's an opportunity here. How do we take that conversation forward?
I can answer. I'm just checking if I can't see everyone in the room, if Bridget's in the room as well, because I know there's been some recent conversations with myself. I've been involved with Bridget, Sarah Fleming and Katie Ball in the city. So I think in terms of next steps, it probably is considering a workshop. I think we're just at the stages of agreeing whether that might be sensible to be done city county, because we wanted to have that conversation around how we take the opportunities that BCF would offer as a tool forward in our in our next steps around. So like what you said, Victoria, I think that can happen at place. I think if we want to take the opportunity of BCF as a tool, we need to join that up. And I think we're just at that point, we can carry on with BCF as it is, and we'll meet the national conditions, or we could use it more as an integrated planning tool if we want to do that. What you've just said is really important, and I think probably a workshop type space where we make sure we're joining that up and planning how we're going to do that together is probably the next step. But we're just at that point, I think, of deciding how we do that. But I think Bridget, Katie and Sarah would be the ones just to inform next steps. We'll probably be looking at bringing paper a summary of the review and feedback either to one of these meetings or through an update to this meeting, I think, in the future. But yeah, what you've described is one of the next steps if we want to take that approach with BCF going forward.
Thank you, Naomi. And we had our first workshop on the BCF, but it was more understanding the nature of the funds, how they were divided up, where they were coming from, who were the contributors and who were the partners in relationship to that. And it was always planned to have a second workshop that was going to analyse in more detail how the money was actually spent and where we would choose and what projects we would choose to do elsewhere. We did look at quite a number of workshops that were done around the country, and I looked at quite a lot of the different things that different people were doing with the Better Care Fund, and it was quite innovative in many areas. And that was the idea that we have Victoria gotten to the first step of a 2 or 3 stage progress, and Brian, at some stage we were going to sort of schedule a follow a workshop for the Better Care Fund, and I think that's probably where we'll be in the near future. I'm going to take one more question, Councillor Tideswell, and then we'll move to the recommendations. Councillor Tideswell.
Yeah, I think half of my questions have been answered. I was saying, the Better Care Fund, is it actually for palliative care as well? And how quickly responsive can that be for palliative care?
I think the answer to that's probably that a small proportion of some of the palliative care is shown within the BCF plan. But I think if this group wanted to understand palliative care pathways in more detail, there would be probably separate programs of work that would know the detail of that. But it isn't it's not contained within the BCF oversight as it stands. It would more, I think, if I'm thinking about what's in the plan, what we badge a lot of our core services as BCF, it would be some of our integrated community health teams. But I think we don't have that level of granular detail. It's an example of it, of how much of the level of around pathways that we don't route through BCF at the moment, through our BCF conversation. There'll be other programs of work that could answer that question and bring information to this group. It's just not routed through BCF at the moment. It's not how
Thank you,
have oversight.
Over to Dr. Tillon.
Thank you, Councillor Tideswell. In terms of palliative care through the End of Life Board and from a Mid-North perspective, the End of Life Alliance, the development of the pathways and answering questions, it's something which we could consider in the future, because the blueprint of End of Life Alliance in Mid-North is what's now being replicated across as a system across the ICB. So the End of Life Board, we could, if that's something for a future present update, something which we can ask the End of Life team to present. Yeah.
By the week. The recommendation is to ratify the Nottinghamshire 2022-2023 Better Care Fund year-end report template that was submitted to NHS England on the 23rd, 2023. I move the motion. Seconded. All in favour. The motion is passed. So at
just that I think the point that was made around the importance of how this fund is looked at within the context of integration is really important, and obviously you have delegated approval from this board to manage that, and I sit on the partner board in the city for this particular Better Care Fund. So just wondering if we could also add a recommendation from this board that we do take forward that workshop as said, but in the context of us understanding how it fits within the
I think
the
the
whole thing.
recommendation is
Just I
merely
think it's
on,
so important.
this is a recommendation merely on the finances, which is a statutory obligation that we have to approve from Naomi's point of view. But Bryony, I'm happy to schedule, as we had intended to schedule,
Thank you.
part 2 of the Better Care Fund workshop. Part 1 was riveting. Who knows, part 2, sequels sometimes are better than the original, sometimes are not. So we're all those in favour, motion passed, and we're going to move on to item number 10. And item number 10 is a review of the Health and Wellbeing Board by Bryony Jones.
Yes, I have 2 reports this afternoon. I'll keep it very brief because I can see it's 4 minutes past 4. In essence, what this report is proposing, with the support of the chair, and also there's been conversations with Melanie, the corporate director for adults, and Colin, corporate director for children's, and Jonathan as director of public health, about how we think that it's probably the perfect time to take stock and have an independent review into the Health and Wellbeing Board. So there's been a lot of positive changes that the board and its members have implemented in the past. Picking up Councillor Wilmot's point about too many priorities, we did a bit of engagement on our last strategy and how well it was delivered and what could we learn from it. And one of the things was, can we have a smaller set of strategic priorities that we deliver well and that we are focused on? And we took that on board, and our new health and wellbeing strategy reflects that. We also heard that we'd like greater communications and a better partnership identity of the board. And again, we went away and we delivered a new website. We have a more resident-friendly hard copy of the strategy, so we made some really positive steps in that direction. And similarly, Healthwatch and others had raised ideas about how we could better strengthen our membership. And again, we took that on board and we actioned it. Having said that, in the last year or so, there's been a lot going on in the local health and care landscape in terms of new strategies, new partnership boards. Within public health, we have a new domestic abuse duty, we have substance misuse responsibilities from national government. So there's a lot going on. And so what this report is proposing is that we think the timing is really appropriate for us to kind of have a bit of a review of the Health and Wellbeing Board and what its strengths are in the system, what is it bringing that other boards aren't bringing, and any opportunities to further improve and further strengthen the work that it does on securing better outcomes for our residents. And what I will very quickly do is share my screen, which will just outline very simply what we're proposing to do. So I've had conversations with the local government association. So I'm a bit nerdy when it comes to the Health and Wellbeing Board. We have done reviews in the past and we have used the local government association to do them, and they've been a really strong independent partner in providing that expertise on how you can work at a system level and in partnership. And I'm very pleased to say that they are happy to come along again in the autumn and do a similar exercise with us. So what the report has, it has a few highlighted policy recommendations. There's been a lot of national reviews into health and wellbeing boards and how it fits in the ICS. We've got some local data from engagements I've done in the past on the health and wellbeing strategy and how we can sort of improve our performance in that regard. And then what we would then bring in is the local government association, and they can bring and put together an almost expertise group of ex-health and wellbeing board chairs, directors of public health, other members of boards in the local area, and they could provide that friendly scrutiny on our performance and give us some strong recommendations about how we can further strengthen our position in the Health and Wellbeing Board, in the health and care system. So over the summer, it would be doing that research, looking at best practice, other boards, how they function, coming up with some ideas ourselves. We'd then have that reviewed by the local government association. We might do some one-to-one sessions in September with some key members to hear their perspectives, possibly also past members as well, because we know we've had some changes recently. In October, we'd have a workshop with yourselves where we would share what we've learned so far, hear from everybody in terms of what they think is really important and how we could improve the work of the board moving forward. And then in December, with the local government association, we'd come back with some findings and recommendations. And then from the new year, we would then start to implement these changes moving forward. But in essence, this report, with the support of the chair, is asking for your endorsement to basically get the steps going on undertaking the review.
Fantastic. Yeah, I think you can learn an awful lot by stopping and just having an external assessment of what you're doing. And I think that's all part of being a system, being prepared to review what you do and adapt and move with the changes that are necessary. And some of the most interesting things you find is when you look to see what other boards are doing and what other areas are doing. You have to keep in mind that a lot of them are looking to see what we're doing, and quite often find that Nottinghamshire is actually a leader in many of those things. Certainly Kathy McLean and the ICS quite often gets consulted by a lot of people around the work and the speed at which we've managed to get to the stage that we're in. So I think that's very nice. Councillor Wilmot.
I didn't realise that it was 8 years ago since the last review. Yes, so I think it is overdue, isn't it?
It must have been a glowing review, Councillor Wilmot.
Yeah,
kept us going all
but
this time.
I'm just looking at the report, the surveys that's been done. Some of them, fewer than half of the council respondents indicated they felt the respective responsibilities of the Health and Wellbeing Board and integrated care partnerships were clear in their area. And then you've got the one that says only 36% of respondents felt involved in influencing and shaping the strategies and investment plans. And then it goes even down to saying that effective partnership working arrangements with other HWs within their is of moderate to a moderate extent. I'm just saying that it is overdue, and I just wondered if from the young lady, you can tell me if you got any answers to these already, or is it this in the review? All these survey results, the 4 survey results, are they in the review, or have you got some answers already?
Yes, so what is included in the report is nationally, and I think it was probably spurred on by the changes to the Health and Social Care Act that came into play in July 2022. A number of national bodies did some surveys, and I think actually members of our board participated in the County Council Network survey that was requested. What this alludes to is that's the national finding of how the boards view their position in the health and care system. What I would say is every health and wellbeing board's a little bit different. So how we do things is slightly different from how they do it in Leicestershire. But I would say what the findings are highlighting is the fact that with the new integrated care partnership and the integrated care board, a greater clarity on what the health and wellbeing board is doing in that respect is sort of the key summary findings that a lot of the national reviews have found, in the sense of we're all working on prevention, but what are we doing that's slightly different from what the integrated care partnership is doing, etc. So they aren't local in the sense of I don't have information on what Nottinghamshire and what our board think in terms of their relationship with the integrated care system, but it's just flagging some national findings around that particular issue.
So we've just got to make sure that we're telling everybody what we're doing. I mean, some of the work's brilliant, but if you don't let your partners, partnerships, or organisations know what you're doing, it can be a problem.
That was always the challenge when health and wellbeing boards were established back in 2012. The fact that they were vehicles through which a lot of health and wellbeing was clearly discussed, but they didn't necessarily have the ability to implement at the level at which they wanted to do that. That landscape has now changed, and the ability to influence and bring about change not only within our own 820,000 population, but within the ICS, the 1.2 million population working together as a system, it's never been greater. And the abilities to do it are for the first time within our grasp. And I think it'll be quite an extraordinarily different vehicle to what it strives to achieve over the next number of years. And I think people will automatically feel more involved because, as you've seen, the whole structure of the Health and Wellbeing Board has changed to bring on board those people who make those changes, from the ICB to the place-based partnerships, etc. And therefore it has, by the very necessity of change, become more dynamic, and therefore you're comparing two completely different beasts, so to speak, the original Health and Wellbeing Board with today's Health and Wellbeing Board, which is quite strategically and just instrumentally different. So I think whatever was found in the past will be, the past is another country. I think it's the future that's most interesting. The next report, I'll pen it tonight for you. Yeah. Right, thanks very much indeed. I'm going to move to the recommendation there that we approve the undertakings of a review of how the board can deliver its responsibilities most effectively in the current health and care context, and establish opportunities developing the board's role. And that brings us on nicely to the work programme, and obviously, oh yes, I'll move that recommendation. Seconded. It's getting late. Thanks very much. So we'll move on to the work programme at 4:15, and I think this is where certainly we'll see the external review cropping up, and so it will do. And those of you who are new to the board will see the mixture of workshops, which are obviously completely dynamic. Sometimes we'll do a hybrid workshop where half of it is formal, half of it's workshop, and the rest of the time it will be bringing the new joint strategic needs assessments before you, bring in the new post-COVID impact assessments before you, etc. And obviously trying to keep the themes going, and at the same time bringing forward our progress around the strategies, etc. Bryony, is there anything exciting that's hidden within this report on the work programme?
Nothing hidden, but what is exciting is that September's board meeting will be focusing on our healthy and safe communities ambition. So you'll have lots of updates around homelessness, domestic abuse, substance misuse, and a JSNA chapter as well.
Fantastic. I hope to see you all there. Councillor Wilmot, yeah, it's going to be exciting. You've heard it here first. Right. Thank you all very much. 4:15, and we'll see you at the next meeting. Thank you.